Welcome to Apothecary Talks. I'm Dr. Jillian Stansbury. This short recording is part of a series of different segments aimed at teaching the actions of herbs. Learning herbal actions is an important step to being able to create effective herbal formulas. In fact, mastering the actions of herbs is one of the first steps to becoming an herbal clinician. It's usually far superior to carefully understand and give a thoughtful consideration to what actions you want your formula to perform, to avoid the kitchen sink-like approach of simply considering what herbs are good for different kinds of conditions and trying to squeeze them all in a tincture or a tea or a formula. Herbs are good for diabetes or good for high blood pressure or good for a kidney infection because of certain precise actions. And if we don't carefully consider what those actions are, we might not choose the best, most appropriate herb. And part of that is learning materia medica, those medicinal materials, which are our list of medicinal plants that have specific niche indications, learning to recognize certain patterns. Are they warming? Are they stimulating? Are they hot? Are they cold? And learning their precise actions to be able to put together the most important and effective formulas. This short segment is going to do a quick review of counter irritants. This category really has no equivalent in Western herbal medicine or pharmacy. And just as the name applies, counter irritants are typically fairly harsh, strong, irritating, resinous, alkaloidal, irritating compounds that will stimulate a tissue. And we'll flesh that out here as we go. A counter irritant is an agent with an irritating effect on the skin, the oral or the respiratory mucosa, throat or digestive passages, or the urinary organs. We use these counter irritants in just very small quantities, usually in deficiency states. We choose to include them in a formula to stimulate circulation when it's deficient, or stimulate secretion when there's insufficient secretions, to stimulate peristalsis when the gut is rather slow, to stimulate glomerular filtration when the renal function is insufficient or there's very slow movement and formation of urine through the kidneys and through the urinary passages, or to stimulate mucociliary apparatus, those little tiny hairs that help move mucus upwards out of the lungs and help us expectorate. All of these things can become damaged by certain diseases or influences, like smoking can harm the mucociliary apparatus and leave smokers prone to chronic bronchitis, and that might indicate the need for specific herbs, not just any and all herbs you've ever heard of that are good for bronchitis, but those that thin old stuck mucus and stimulate the mucociliary apparatus. Similarly, we might have kidney infections that can be hot, acute, smoldering infections where we don't want to use counter irritants. But on the other hand, we might have people who are prone to bladder infections and prone to kidney infections because of such slow filtration through the glomeruli. For example, a diabetic with glomerular nephropathy that might have very poor circulation to the kidneys, a lot of sugar in the urine, poor emptying due to autonomic difficulties, and we want to use a tiny little bit of a counter irritant in our formulas to stimulate that circulation or that glomerular filtration. So such stimulation is desirable only in situations of chronic deficiency and stagnation. And we want to avoid counter irritants in acute infections where fever is high, when the tissues are already inflamed and irritated. We don't need these in such circumstances. Examples of counter irritants for the skin would include sanguinaria, that's bloodroot, podophyllum, that's mayapple in the photo there at the right, pine tar, and different kinds of tar and resins in general. Grindelia might be a bit of a counter irritant, and then actual insect venoms. There is a therapy known as apitherapy named after honeybees, which is the Apis genus, where bee venom is actually used. And if you would go to some of the medical research sites, there is a large amount of research going on anemone poisons and different kinds of venoms from insects and even snake venoms to treat immunodeficiency states or to stimulate an immune response or to bind them to different chemotherapeutic agents because they wick into cells and into lymphatic tissues more readily. So there is ongoing research of some of these profound irritating, if not outright poisonous substances, but there's a long history of using bee venom. Other ideas of respiratory counter irritants, as I've said, when there's stuck, stagnant mucus that we can't expel, or when people are just so damp that they create a great catarrhal state and it's difficult for the body to expel it, and all that mucus in the lungs becomes a breeding ground and makes people be prone to pneumonia. Sometimes adding a little bit of horseradish, such as is in the photo there, or a little bit of cayenne pepper helps thin mucus secretions, and it actually irritates the respiratory passages such that they make new mucus. New mucus tends to be thin and watery and can help push that old, stagnant, rubbery, sticky mucus out more readily. So there is the concept of a respiratory counter irritant. A urinary counter irritant is rarely used, but something like juniper berry, if you would take a whole bunch of it, could irritate your urinary passages and even create burning of urine and discomfort. So obviously we avoid it in most people and in most circumstances. Yet for an elderly person or somebody with very poor glomerular filtration, you might use just a few mils of juniper tincture in the base of other more nutritive and tonifying herbs or demulcents and soothing things to balance its harsh effects to actually improve glomerular filtration rate, or for people prone to stones, elderly people with sluggish renal function, people that make really dark, thick urine with a lot of particulate matter in it. And we avoid using juniper for acute bladder infections or your more run-of-the-mill UTI. Musculoskeletal counter irritant is an unusual concept, but again, it's the use of bee venom, or there is a history in many medical circles of using nettle flagellation, meaning you actually hit your sore joint or knee with nettles to sting it, and that stimulates an immune response, and it stimulates all those cytokines and inflammatory mediators, even though if it's more acutely inflamed for an hour or so, for the weeks thereafter, it tends to promote a more healing effect. So a brief inflammatory effect. So this is a crash course without us having time to go into all of the details, but I provide a great number of such formulas for the respiratory system, for the urinary system, for the musculoskeletal system, and the skin in my textbooks, Herbal Formularies for Health Professionals. It guides you in specific formulations and talks about hot formulas versus cold formulas, or when the use of counter irritants would be appropriate. I also take people on field trips to the Andes and the Amazon, where I've studied with several indigenous communities for over 20 years now. If you would like to join me, please write to me at bghealingarts.apothecary@gmail.com. And I also maintain a website with links to many of my recordings, webinars, and podcasts. There's also a number of beginner files for downloading that I share, PDFs and blogs and recipe files that you are free to peruse and see what might be of interest to you. Thank you so much for watching Apothecary Talks, and I hope you can join us at future recordings tutoring in the actions of herbs. Thanks for watching.